Nursing may be defined as the diagnosis and treatment of human responses to health and illness. The definition given by option A, Florence Nightingale, option B, American Nurses Association, option C, Virginia Henderson, option D, World Health Organization. The answer is option B, American Nurses Association. American Nurses Association defined nursing is the diagnosis and treatment of human responses to actual or potential health problems. According to Florence Nightingale's environmental theory, defined nursing as the act of utilizing the patient's environment to assist him in his recovery. Virginia Henderson defined nursing is the unique function of the nurse is to assist the individual, sick or well, in the performance of those activities contributing to health or its recovery. According to WHO, nursing encompasses autonomous and collaborative care of individuals of all ages, families, groups and communities, sick or well, and in all settings. It includes the promotion of health, prevention of illness, and the care of ill, disabled, and dying people. Which of the following nursing intervention is appropriate when an IV infusion extravasates? Option A, elevate the site. Option B, discontinue the infusion. Option C, attempt to flush the tube. Option D, apply warm moist compress. Answer is option D, apply warm moist compress. The same question asked like, the first step the nurse do when an IV infusion extravasates. That time the answer is discontinue the infusion. Transplantation of Human Organ Act was in the year. Option A 1990, option B 1995, option C 1994, option D 2010. The answer is 1994. Transplantation of Human Organ Act was passed in 1994 and is aimed at the regulation of removal, storage and transplantation of human organs for therapeutic purposes and for prevention of commercial dealing in human organs. Bombay blood group is a rare group with option A, B and H antigen, option B, no A, B and H antigen, option C, antibody H and no H antigen, option D, no antibody H and H antigen. The answer is option C, antibody H and no H antigen. The Bombay blood group was first discovered by the Dr. Y.M. Bender in 1952. This blood group is called Bombay blood group because it was found in Bombay. Bombay blood group does not produce H antigen. A nurse wrongly infused an IV solution containing potassium chloride too rapidly. Which of the following is appropriate intervention advised by the physician? Option A, rapid infusion of IV Ringer solution. Option B, rapid infusion of IV normosaline 0.9%. Option C, insulin added to 10% dextrose in solution. Option D, administer albumin. The answer is option C, insulin added to 10% dextrose in solution. Management of hyperkalemia. IV calcium gluconate. IV calcium gluconate stabilize or protect the heart from arrhythmias. Calcium gluconate does not decrease the level of serum potassium, but it protects the heart from the arrhythmia. Next management is combination of insulin and dextrose. Insulin push potassium into the cell and decrease the serum potassium level. Insulin causes hypoglycemia, so the dextrose gives insulin to prevent hypoglycemia. To decrease the total body potassium level by giving loop diuretics and potassium binder name Kayexalate. Loop diuretics help to decrease the level of the potassium by excreting potassium through the urine. Kayexalate increases the potassium excretion by binding the potassium in the lumen of the gastrointestinal tract and excreted through the feces. ECMO is contraindicated in option A, controlled bleeding, option B, cardiac arrest, option C, neurological impairment, option D, postoperative congestive heart failure. The answer is option C, neurological impairment. ECMO or extracorporeal membrane oxygen, also known as extracorporeal life support, is an extracorporeal technique of providing prolonged cardiac and respiratory support to patients whose lungs and heart are unable to provide an adequate amount of gas exchange or perfusion to sustain life. Indication of ECMO: respiratory failure, cardiogenic shock, cardiac arrest, post-op cardiac surgery, septic shock, use in COVID-19 patient with acute viral pneumonia. Contraindication of ECMO: limited vascular access, inability to accept blood products, severe coagulopathy, severe brain injury, metastatic cancer, severe aortic insufficiency, aortic dissection, irreversible cardiac failure. Scimitar syndrome is also known as option A, acute pulmonary syndrome, option B, pulmonary venous syndrome, option C, pulmonary venous lobar syndrome, option D, pulmonary lobar syndrome. Answer is option C, pulmonary veno-lobar syndrome. Scimitar syndrome or congenital pulmonary veno-lobar syndrome is a rare congenital heart defect characterized right pulmonary vein rather than draining into left atrium. They drain most commonly through inferior vena cava into the right atrium. In radiograph shows linear curved opacity parallel to the right border of the heart, which has the shape of a Turkish sword or called scimitar. So this sign is called scimitar sign. This syndrome was first described by Dr. Catherine Neal, a British pediatric cardiologist, in 1960.